Here. Senate Bill 704. It's a bill to discuss a task force to start to implement a universal health plan here in the state of Oregon. A report on OHS website says today 94% of Oregonians have coverage. Despite Oregon's high rate of health coverage, more people could be covered. Most people who were uninsured when the study was conducted were eligible for the Oregon Health Plan or a subsidy to reduce the cost of commercial health coverage. There are currently about 243,000 uninsured people in Oregon. If 80% of those who lack health care coverage made use of the Oregon Health Plan or the subsidies available through the marketplace, healthcare.gov, the number of Oregonians who were uninsured would drop to 34,000. That would boost Oregon's healthcare coverage to 99%. I know we just passed a ballot measure where we said that healthcare is now a constitutional right, but it does feel like this conversation is a solution looking for a problem when you start looking through some of these reports. The 2021-23 legislative budget for all of health and human services was $49.5 billion. The projected cost of this universal health plan is expected to be over $54.5 billion. To pay for this, despite the fact that in the report it says that it would be a $980 million savings, it will implement an employer payroll tax where the employee wage of $160,000 or below will be taxed at 7.25% and above at 10.5%. Yesterday we had our first public hearing. I think over 200 people showed up. I think we maybe heard from 10 of them. There's a lot of people that want to weigh on this. This is an important topic that's going to take significant time for us to weed through. Thus ends part one of a continuing remonstrance the rest of the week. And it really is in response to ultimately the task force 770 that put forward a recommendation for a universal health care plan and specifically a single payer. It's just such a complex issue. I want to highlight some things as we pursue this endeavor. The universal health care plan revenues projected for 2026 are broken down again to add up to the $54.6 billion. It's $12.9 billion from Medicaid, it's $11.8 billion from Medicare, other federal investment of $1.6 billion. The employer contribution, I started to talk about that yesterday, that tax of how that will hit people, 7.25% for under 160,000 in earnings, 10.5 over 160,000 equals $12.3 billion. The individual contribution, which we have not talked about yet, is $9.7 billion, and then other state investment of $6.4 billion. When we talk about these taxes, that employer tax is expected to decrease approximately $170 million from what employers would pay in employee premiums. So you got to understand the intent here is that we won't have private insurance funded by big corporations, that they will now pay into this system. I don't know if people back home, when they voted for healthcare to be a constitutional right, knew that this is what we were talking about. So as we move forward, I just want to make sure that we as a body are making sure we're communicating back home, we're clear and transparent with what this system will look like and how individuals will interact with this now. More to come tomorrow. Here, I want to be clear why I'm talking about this and my concern. Senate Bill 704 came up yesterday in committee again, and in the presentation it was mentioned that this only forms a task force, but I want to read Section 5 as the foundation of why I'm concerned. Section 5 of 704 says the comprehensive plan created by the Universal Health Plan Governance Board, which is going to be created under this act, must implement a single-payer universal health plan that is in keeping with the findings and recommendations of the Joint Task Force on Universal Health Care in the report approved by the task force on September 29, 22. So when I read from this task force findings, the 220-page document, my concern is that what's prescribed here is what is being mandated to this task force to follow, to implement. So I'm not making this stuff up. I'm just correlating the two documents and reading as I understand what the bill says it's to do. Now, finally, in summary, this suggests in this report that these dollars are actually a savings. right? I want to be clear. I've been talking about $22 billion in new taxes, but it could, according to this report, in theory, be a cost savings to the overall health system. I'm not sure I agree with that conclusion, but that is what it says. So the current system would be $11 billion in taxes to households. The new plan would be $9.7 billion. The current tax to employers, 12.4, would be 12.3. So could it be savings to the system? Maybe. I see it as $22 billion in new taxes. I'm not sure that's what the people are asking for.